Hello, everybody. Welcome to this series. We're going to have a very insightful discussion today with Dr. Sana Smriti here. She's a developmental pediatrician, and this topic today will be about what are the different ways and means, or the different ways that we approach once the child is diagnosed with an autism spectrum disorder. And we will be talking about different therapies and what will be best suitable for the child, and so many other things that will come up. So I'm a parent of a person with autism. He's now 24 years old. So we will be having a good discussion from the professional or the expert point of view, and as well as a parent point of view. So, Dr. Sana, so what is your recommendation when a child is being diagnosed with autism? So, what should be the next step the parent has to take, or what are the other things that the parent has to think about?
Yeah. So usually most of the children that I see, or what is recommended, autism spectrum can be diagnosed at any age. It could be a child who is a toddler from 2 years to 6 years, as well as sometimes we come across children who are a little older, like maybe 6 years, 12 years in school age, any of these ages. What is more important for us, once we know that due to some reasons this child is showing a profile that looks like autism spectrum, it is important for us to know the needs of the child. Typically, this can be done either by a developmental pediatrician or a child psychiatrist or a pediatric neurologist. And once this is done, the mainstay of how learning happens is not basically through medications or through uh, any sort of, I would say, any interventions which are invasive, but mostly it is through techniques that help the child to learn a certain skill or work on science or areas that are the core features of autism spectrum. So, by this I mean it could be social skills, it could be communication, it could be speech. Every child is different. Each child's uh, I would say each child's profile looks different. Some children are verbal, they talk. Some children find it hard to speak or express themselves to others. While those who are talking, it may be hard for them to communicate with others, but may be able to say things which are more concrete, like maybe say alphabets, rhymes, or say things that read out things in the environment. But it may be hard for them to use the same language in a context of communication. So, keeping all this in mind, what I'm coming to is all of this works from the brain. The brain sends signals for us to show certain developmental uh, stages, and sometimes that can be different. When it is different, it is important to have opportunities for the child to practice these skills. Basically, a therapy follows the same kind of a principle, wherein we yeah, the therapy is directed to help the child learn certain skills, but not through a medication, not through invasive methods. Yeah.
Okay, so you were mentioning about therapies. So what is meant by therapy, first of all,
Yeah.
and what are the different therapies also?
I know for many parents this is a very new term. Sometimes it's the first time they're hearing the word therapy. Often nowadays, when we type the word autism spectrum and what to do, there are so many things that pop up on the internet. Uh, so, what even within therapy, there are many words and terms that pop up either when you look out for or even hearing from other people. And that can be a place where it's a bit confusing for people who research on these topics. So when I say therapy, it actually means nothing but a teaching space, a space where a child is provided situations wherein they are more specifically, we all learn from our natural environment. How learning happens is by encountering situations which help us to try different solutions, and that sends a signal back to our brain to learn a particular skill. Sometimes that can naturally picking up on some skills can be hard for some children. In that situation, a therapist can help you out. What a therapist does, and there can be different types of therapies depending on what skill we are thinking about, or what behavior or area of development we want to focus on. So, what a therapist basically does is create more specific situations and more specific instruction ways to help a child learn certain things. It's nothing but a teaching way, but more specific and more scientifically oriented. And it is also backed by a lot of research on what skills, how they need to be broken down, and which are the skills that have to be taught and in what way. So that way therapy has many approaches. Like, to answer your question about what kind of therapies are available, so there are many different types and therapy areas. Each Every child will not have a specific prescription. It's not like a medical condition. It's not like we are saying a child needs only BT, speech, OT. These are the different names that we will commonly hear. So the common therapy uh, uh, types that we come across is autism therapy. This is An autism therapist is someone who is specifically trained to work with children who are on the autism spectrum, and it includes approaches from behavioral therapy. It can include some approaches from the behavioral therapy itself has different approaches, and an autism therapist will be more specifically trained. In addition to that, there can be a speech therapist who may play a role. There can be an occupational therapist. There can be special educators who play a role. And more importantly, even counselors play a role to support the emotional aspects of a child. Yeah.
Okay, thank you. So this brings the next question, wherein, yeah, as you said, there are multiple therapy options available. So often there is a confusion. Okay, what will be the best thing that is suitable, or
Mm,
should we approach all the therapies at a time for the child, or is there any correct pathway to go through this,
mm.
or what is it? I mean, how? What is your recommendation?
So, in order to give a recommendation, it is important to know the child. No two children will be the same. Just like any two children, even on the autism spectrum, no two child will look the same. Autism spectrum is the word spectrum itself is what it means, that every child is different. If you have met one, it is very, uh, it is a sentence that we often use to describe autism, that if you have met one child with autism, you have met only one child with autism, which means that every child is unique. And this brings us to the point that it is important for us to know the child. Only then we will be able to suggest what is the therapy that this child will benefit from, how long the therapy needs to be done, and what is the purpose of this particular therapy. So it is also important to know not just what therapy, but also why this therapy, and what is our goal from sending us to this therapy. So, in the sense, for example, a speech therapist will mainly focus on the speech, the verbal aspects, or any form of uh, communication to teach or help the child learn skills of communication. And sometimes, when I say communication, it can be non-verbal ways of communication, including pictures, including other forms of communication. In And speech therapists can also help in supporting understanding of language, whereas an autism therapist may support with building or learning social skills, or learning helping with managing behaviors that can be sometimes look different. Yeah.
Mm.
Occupational therapist helps a child to attend to a skill, attend to a place, or attend to an activity. Sometimes some children find it hard to pay attention to something, an activity or whatever they're doing, or to their environment for a long time. So an OT plays a role in supporting that, to help the child to sit and do things, to help the child also to build motor skills. At times, the movements can be a little different. It's not common, not that all children face these issues. For different children, it's different.
So, doctor, like, what is your recommendation? Like, how long the therapy should happen in a week or in a day? So, what are the a number of therapies and what is the duration?
Right. So, typically, uh, like I said, every child is different, and the duration of therapy
Mm.
will vary from child to child. There is no one particular recommendation that so and so number of hours. There are some recommendations, but it is not a one solution for all kind of a recommendation. It is another important thing to talk about here is that a child learns from different places. It is not only from the therapy room. And more importantly, children learn, especially in early years, they learn best from their natural environments. They learn when they wake up in the morning from the bed, they learn when they're entering the car, they learn when they're taking a bath, they learn when they're constantly exposed to different situations right from the time they're awake until the time they're sleeping. Thinking about this, imagine it's like a day is a full of learning opportunities.
Mm.
There is no one particular situation where you're learning. And also, children, and not just children, children and adults, all of us learn best when we are most comfortable, when we are engaged with the activity, and we are truly involved in what we are doing. And sometimes that may not happen in the therapy room. The therapy room, one day may be a great day, the other day may, you know be not such a very active day because the child didn't wake up early or whatever
Mm.
reasons. It may be just not the right day for the kid.
Okay.
And it's not like every moment is uh, you cannot cash in and have the child to be there in a particular room for
Mm.
every session.
Correct.
Another thing is also, uh, how does learning happen when there is a sort of uh, in in a connection between the teacher and the child, or the
Mm.
therapist and the child.
Mm.
And this connection also happens in other situations during the day with the child. It can happen between the parent and the child, or the caretaker and the child. It can happen between the liftman and the child, or the grandparent and the child. Everybody throws different kind of responses to what
Mm.
the child does, and the child also connects through different activities and situations with different people.
Yeah.
All of them are opportunities for the child to learn, and these are very good opportunities, much more, uh, I think, much more um, helpful, and much more probably effective, because the
Mm.
child is a part of that process. And another thing is, it's a routine. Especially children learn best in when there is a routine. Like there are some things that the child does every day, like
Mm.
brushing or bathing, eating, putting clothes in the washing machine with mom. It could be, helping the mom to put while being around, when
Mm.
somebody, the father or the caretaker, is putting things in the uh, sorting things in the kitchen. Any
Mm.
of
Mm.
these are all situations that different children like different things.
Mm.
Now, what I'm coming to is, it's important to know uh, what is helping to support your child, what are the strategies that you can use as a caregiver or a parent or whoever is there in a child's life. Them being a part of this process of knowing the specific ways or specific strategies that they can use in day to day life is the most effective form, especially in our context.
Mm.
uh, Many times attending the therapy session, going to the therapy center itself involves a lot of planning, logistics. It may be that today the child is sleepy at that time, right when you have planned for the whole day and you've reached the center, and you find that it's a child is not in the best form to learn, and that's only 1 hour. Usually therapies are for 1 hour, sometimes 45 minutes each therapy session. And that's and within that 1 hour also, it is not that you're constantly learning. The child needs breaks, and
Yes.
every child needs break. So
Yes.
coming to the question that you have asked, there is no one particular duration. It's not the quantity,
Mm.
but the quality of interaction and the principles that we need to follow
Mm.
on how children learn, that will help the and make the therapy sessions more effective.
Yeah.
Yeah.
So, as you said, quality is more important than quantity, and we can't we can't always equate,
Yeah.
time and the effort we put
Mm.
for that day, and immediately there is something that we see. No, the
Yeah.
result. Yeah.
Yeah. What has your experience been, Lavanya, with your son?
Uh, in terms of
Yeah,
therapy.
in terms of how you could access therapy, and or in the therapy rooms also while you
Mm,
are doing therapies,
mm,
because these are common things that I come across where I see parents working very hard, and with the logistics, wanting to go to the therapy sessions because somebody's advised them therapy,
yeah.
and every parent wants the best for their child.
Correct.
So what has your experience been in accessing therapies, or even while you're taking your son to the therapy center?
So this was very long time ago, where the awareness was very very less. So the term therapy was only very new. I mean, I came to know after diagnosis, after maybe 1 year or so, that there is something called therapy that we
Mm.
has to be given, and there are many things beyond that and all. But as you say, this therapy for me, um, those days, I just knew that there is an occupational therapy
Mm.
and there is a special education.
Mm.
I mean, many other terms were new for me, like behavior therapy and all this.
Mm.
In terms of occupational therapy, um, I actually found it very useful because my son had a lot of sensory issues, and once the therapy started begin, I could see a lot of changes. A lot of calming down happened, and the best part is that I had also consulted OT person,
Okay.
and the person had given me a home program apart from the therapy that happens.
Mm.
Okay, so that was very crucial for me because I understood actually the basic concepts of what are the different sensory needs that he has, and what are the different activities that can be done so that his needs are satisfied, and
Mm.
that I could do at home only in
Mm.
certain intervals of time. Usually I do it in the morning and in the evening once he's back from the school.
Okay.
So that way, there was a constant uh, therapy at home in his comfortable, as you were also recommending. It doesn't only happen in a therapy room. It can
Mm.
happen in any other place.
Mm.
There was a regimen that was happening, but once I started understanding the basic concepts,
Mm.
I would take him to a beach. I mean, it would be like every week I take him to the beach. I make him walk on the sand. So that becomes a therapy.
Wow. Mm.
So I mean, there would be some silly things that we would play with some flower and something like that. But then later I realized that, every little thing, every single thing was a therapy. So that was for the OT part. But in case of special education,
Mm.
the best thing that happened to my son and myself is that the therapist was recommending me to sit along with her, so I could really learn what is happening, so that I could actually practice the same thing at home, be it
Mm.
a communication or academical or whatever it is.
Yeah.
Yeah.
Did you ever feel like, I may not be the best person to do this therapy? It would be better if the therapist does it. Were there any situations like that?
Um, there were challenges for me. There were hiccups that, I'm stuck with something, but I that actually pushed me to think beyond. So I would actually ask people, know from people, or I would also search from the net or some books, and
Mm.
also through other parent experiences, because that is again a very crucial thing that I found it very useful. Um, so I didn't feel that I am not capable, but I thought like, yeah, I need more support. So reaching out
Mm.
and getting support, and then using it, uh, is what I was trying out.
Very nice.
Yeah.
I mean, it's really nice to listen to a story. I mean, it's wonderful to see how you know that you are able to work with your son, especially use the situations where you are there with him, which are not during the typical day when therapy needs to be done. How did you why did you find that so important at that time, that you know things about what is happening in the center, or learn, get support from the therapist?
Yeah. See, I always thought that, to understand him is something very, very important, because earlier, say, I could actually demarcate it like this. Before the therapy started, I told you it was a very long gap.
Mm.
So there was no clue, nothing, and what is to be done, not to be done, and what is the future ahead. So there were more many questions and many things that were piling up. So, and also, there was an underlying thing that I'm not able to help. I mean, a feeling of helplessness
Mm-hmm.
was there. But once the therapy started and there is a guide, and I feel that all the therapists or the people, the experts, they are very good mentors, basically, because
Mm.
we can always take a lot of support from them. And also there is a guidepost that they show, and also make you understand what are the child's challenges, strengths also, and also what is to be done.
Mm.
But I think that, from the developmental aspect, from every little movement of the child, a parent knows the child better. So combining this, the things that we get from the mentor and the things that we naturally will understand,
Mm.
so these two put together, I think it's very important,
Yeah.
and that's how organically I think it moved on.
That worked best for you.
Yes, yes. So, Dr. Sana, the therapy center as such, right? So, what do you think the parameters or the characteristics of the therapy center should be, or the therapy room should be, so
Mm.
that it is very congenial for the child as well as the parent to be, because ideally, parent is also going to be there. So, if that is to be the case, how do
Mm.
you recommend the therapy center or the room specifically to be?
As such, every therapy center has different sizes of rooms, different shapes, and different things that they have in their surroundings. Our idea of a therapy room is to make it, uh, like you said, make it congenial or make it comfortable for the child to be able to learn.
Mm.
Now, what are the common things frequently that we see? What are some of the things that are helpful for a child to learn? Is a room where there are less distractions, where there, and distractions, by distractions I mean sound or lighting or lot of visuals. It is important to keep these things in mind. There is no one particular recommendation as to how much sound, how much light, and there are some recommendations on sizes of rooms. Uh, However, ideally, the room should be comfortable enough for the child to be able to move a little bit, and it should be comfortable enough to uh, help the child to not get disturbed by the sensory aspects. And sometimes attention can be hard for children to sustain to what they're doing. Having a control over the sensory aspects like the lighting or the sound or the visuals can be helpful. In addition, some kids may need some sort of equipment in the room to help themselves to take a break
Mm.
while they are part of the session. It would always be nice to have such material accessible to the therapist, like, for example, some place where the child can jump to, like a trampoline if possible,
Mm.
or swings. And swings can be of different types and sizes, depending upon the child, what they are usually comfortable with. Some seating places, sometimes bean bags, or depend again the kind of mats that you're using, safety of the place. So before we go to safety, I think uh, a control over the sensory aspects for the therapist too, so that they can modify according to the child they are seeing, and also having equipment that the child might need to help themselves calm down or help themselves to come take a break and come back to the what they are doing. So that becomes important. Also, access to material that the therapist may need or the child might like or may learn from is important. So it shouldn't be like there are lots of breaks in the session where the therapist needs to move out and in of the room, because that sort of disturbs the flow of what we are doing. It's important to have spaces of storage, spaces where toys can be visible, and spaces where things need to be kept inside so that you can access them as and when required. Sometimes if there are too many things outside, it can be hard for the child to focus on one particular thing, and sometimes children may not notice things so easily around, and in that situation we need to put more things around for the child to be able to pay attention to something and be able to choose what they like. So basically, some storage space which is visible, some which may be easily accessible, and some which needs to be kept inside. All of these things can be done. A comfortable seating, even for the parents, thinking about where they can be seated or how they can observe the session. These things make our session more effective. Mm.
So ideally, you say that, for, as you say, mentioned earlier also, every child is unique.
Mm.
So the therapy setting that we will have will be unique for every child as well.
Yes. This
Great.
brings us to the point about the preparation bit also. So,
Mm.
every therapy session needs a certain amount of preparation. And again, this brings us to the point where each therapy session is unique, which means the therapist also has a lot of demand on how they are thinking, on their thinking skills, planning skills, and uh, it's and creativity skills, many of this. It's not just the 50 minutes or 1 hour of the session, but pre-planning, keeping in mind the child and what the child likes, what the child can do, what the child might like, what the child is distracted with, what kind of environment or sensory environment the child is comfortable with. All of these keeping in mind, a certain amount of preparation will be required with the kids that we see.
Okay. So that brings to the situation where uh, the certain planning has to happen, certain scheduling has to happen, and thinking before, okay, this session should be planned in this way, and these could be possible reactions from the child, and how do I have to manage,
Yes,
right?
yes,
So many things are happening
yes.
in that. So do you think that these would be coming from the training, or do you think that it comes after experience?
It is much training. As such, different therapists are trained to understand about children's development and skill set. But once you know that each child learns differently, which is what our training also teaches us, that every child learns differently, their skill sets are different, profile is different. It brings us naturally to the point that the preparation has to be different.
Mm.
um, that is, and how do you need to prepare? Again, the training teaches us what to do with the material, but it also individually it takes time and research to see what are the objects that you have which you can use, what are the material that you can use in different ways. Sometimes the same material can be used for different things in different ways to build different skills. So while the training teach gives us the knowledge, we have to think about it in different ways, use that knowledge to apply to a material,
Mm.
and then think of how to use the material. It comes with practice, definitely, and I think more than practice, it comes, a lot of it also comes from parents.
Mm.
This is where parents can play a great role, because they have automatically experienced situations with their children at their homes, where they see the kid using something on the floor or using some material in the bedroom or in the kitchen, and see them playing in a unique way. This input is so helpful for the therapists, and somewhere during the sessions it helps us to uh, get more ideas and think together with the parent for ideas. That's where the partnership is helpful for us. Mm.
Yeah, this
Like you
is,
were also mentioning about the sand and how your kid used to play with small things in the sand, that would be a great way for us to think about what we can do in the session.
yes,
Mm.
absolutely. Because as you say beautifully, that the partnership. So,
Mm.
uh, it's a partnership between the experts and the parent, or the family even. I mean, not just the parent, because
Mm.
there is usually, in my case, my mother would tell some stories. So that relationship between a grandmother and a grandchild has a good bonding, and there is so many things that the child learns
Yeah,
during that time.
very true.
So the whole family is working towards
Yes,
that.
and it's come so naturally to families, and they know when to connect, when to distance themselves. Many times, sometimes we may be tied up with things, but there are at least some moments where are very unique.
Correct. So this brings another question, because always there is a point that always people think that my child should be able to speak. So
Mm.
speech is the priority. So do you think that there is a difference between speech and communication, or is it the same? Is it an alternate term? Okay, or what, how do you?
No, speech and communication are different, because speech is one form of communication. Speech is words that a child uses or anybody uses, and by using this modality or this instrument of speech, we send a message to somebody,
Mm.
and that sending of message is communication. We
Okay.
can also send this message in other ways,
Mm.
by using actions or gestures, using our body parts to say, like pointing or looking or nodding, shaking, using gestures like come, go, all of this. This is another way of sending a message. We can also send messages by writing. We can also send messages using pictures, typing messages.
Yeah,
And
emojis.
yes, emojis, now it's nice. We have a new modality. So we can share our expressions and feelings that way.
Yeah.
All of these are different ways of sending messages to another person. That way of sending message is called communication. Speech is one form of communication, the most common form of communication, but there are many other forms also. Yeah. So when in therapy, basically, commonly we hear speech therapy as the, and that brings us, it's the most easily understood term because the word itself is speech therapy. So naturally, when you see that your child is not speaking, uh, the commonest thing that strikes to people is we need to go to a speech therapist. But at times, the bigger difficulty or challenge may be in actually in communication. And while it may take more time to build on the speech, what the child may need at that point is some form of communication so that they are able to express themselves to another person. And expression can be their needs, or when they don't want something, or when they want to share something. So at that time, even other therapists can play a role, finding out why the kid is finding hard to communicate. And then sometimes an autism therapist, like I said, they work with core symptoms or core features or areas of autism spectrum, and that can be in communication or in connecting with another person. That is a social skill. Sometimes that can make it hard to communicate. So even helping the child to build a social skill or engaging with others, connection, and helping the child to communicate in any form, this can also be the role of an autism therapist. And sometimes an occupational therapist can also help. But it's important to identify what is the reason why this child is not speaking, and what are all the factors that are impacting it. And accordingly, then thinking about and where to go. Yeah. And a professional can help you do that, somebody who can help you see the bigger picture.
Yeah, I think that's very, very important because, I mean, as a parent, we might be able to understand that there are many therapists, but overall, what is it is needed for the child, and how to navigate through these many therapies, and what would be the priority, and so these are something that are very important.
Did you find any such things while working with Kedar? Like, did you find that any difference between speech and communication, and how to was there any different way in which you worked on the communication?
Yeah, so actually, initial stages, I understood that my son had uh, speech because he would recite some songs and everything. But to ask for something very simple, like I need food or anything, that was a difficult thing. So this, I was finding it very different. Like, if he can talk, why is he not able to tell that he needs something, right? So then I understood from the special educator that these two are different. And also, and then I immediately knew that the communication should be given the preference. So I mean, I used to start like that. So where I used to, I mean, when I started, I told you it was, he was already 6 years old, so he would be able to read a little bit. So I used to write some sentences, okay, and start with yes or no questions. He has to just only, put a tick, yes or no. So, do you want something? I mean, this food, yes or no. So it was just yes or no initially. Many things, even I would also want to know what happened in the school. So that also came through only from yes and no. So it started like that. Then I gave some choices. Then it came to another form of, he writing something, that, this is what I am thinking about. Or we used to also have a game, right? I mean, I would put like mama and put a picture. He loves to draw. That was also an added thing in that. So I would put amma, and I would write one dialogue in this, like say for example, he was feeling upset after coming to school, so and from school. So I would write, yeah, so how are you feeling today? And then he would also put one picture of himself and then put it in a speech bubble key. I'm good, not good, or some simple terms. But that's very interesting thing that happened. So it more initial stages, it was more about only different other ways of communication, not per se speech. But slowly, eventually that happened organically, that he started using this different other communication and speech also.
Wow. How did you know that you can use drawings and pictures to communicate with him?
So, I mean, it was little bit from the sessions I picked up, and little bit I thought like, if he loves to draw, I have to utilize that, because his interest is drawing. Even in the therapy sessions also, so he would like ask, I want to draw, I want to draw. Then finally, okay, fine, once all these are done for the day, we will give you the time to draw. So that passion for drawing, I wanted to cash in. So that's how in many other forms also drawing. And interestingly, he would also express his anger, whatever, in drawing. So that's how I would know that he would draw himself and putting a gun and shooting another kid, because some bullying, something happened. So he wanted to express that aggression through drawing. So many things happened through the drawing, interestingly. And then that's how also I picked up that maybe this is his passion and I have to take it forward.
No, it's so amazing to see how intuitively you pick up on some things, but also, you're pursuing that and thinking about how it can be used in different ways, taking his strength into and taking his area of challenge and strength, and you're using that to build the communication. It's very nice to see how it was not only on making him to speak to communicate, but you used these things. Great. This is it also makes me think about the therapy sessions, like uh, during the therapy sessions it would be so nice to use all of these information and inputs we get from parents, and then design a session in a very like a designer, you're designing each session very specifically and very uniquely, like a tailor to the child's need. It puts us to thinking that many times, we don't want therapists to feel very tired because it's a lot of demand on what they're doing. To think of it, there are so many to know one child, it takes a lot. And like how they say it takes a village to raise a child, similarly, to think about different children and different children's likes and different children's strengths, it cannot be done without partnership. And it cannot be done without having some time for the therapist to reflect on the child and the sessions.
Yeah.
And some amount of time needs to be given to plan for the sessions. And then knowing the child will help you to modify while you are in the session, to modify it when there is a different behavior that day, or when there is a different mood that day.
Correct.
And then again reflect on what happened and use it in the next session. All of this is quite heavy on your thinking processes.
Correct.
many times, the sessions uh, are back to back for therapists, and that can also be challenging.
Yes,
Yeah.
absolutely. So, Dr. Sana, what do you think that what are the guidelines basically for the therapy or the therapy center?
Uh, as such, so if you're asking about the government-based
Mm.
guidelines, not all states have any specific guidelines at the moment. Like we spoke about many things. We spoke
Yes,
about therapy rooms. We spoke about how a therapy session, what is the most effective way of doing
correct.
therapy, parents being in the session, being a part of a session.
Yes.
But at this point, we don't have any specific guidelines for our state, especially Telangana. Kerala has guidelines
Okay.
for therapy centers.
Mm.
Yeah, so the guidelines also mention about the type of therapy rooms, or what would happen in a therapy sessions, even things like form documentation, formulating goals, and having a plan for a short term and a long term plan for children. All of this,
Okay.
qualifications of therapists also,
Okay.
uh, because all of these therapies are trained, courses. Therapists are trained through specific RCI regulated courses, which is the Rehabilitation Council of India,
Mm.
and uh, so the qualifications are something that become important.
Okay.
Yeah.
So, apart from this, do you think that the parent being in the place where the therapy is happening is important?
Yeah.
Mm.
Absolutely.
Mm.
Like I said, we spoke about so many things, and you have shared such beautiful things about what all you have picked up from how you could work together with your therapist who served sometimes to help you with the science behind it, or what is we are trying to achieve.
Mm.
And that can only happen if the parent is there with the child while the session is happening.
Mm.
It's not that only the therapist parent is taking help of the therapist is also taking help of the parent,
Correct. Absolutely.
because the child may be different in the therapy room and
Mm.
may do something else at home,
Correct.
and that information becomes as important to us as what we are doing here is important to you.
Correct.
uh,
Correct.
it may not be that all the sessions the
Mm.
parent is able to attend, but it's important to be part of that process. The doors, like we have always been saying, should be open for the parents to be a part of the sessions. Yeah.
Absolutely. Absolutely. That highlights a very important thing that you were also mentioning about the partnership.
Yeah.
So this, open door is something very important for this partnership to happen.
Correct.
And the prime goal of the growth of the child happens through this.
Yes. Yes.
Absolutely. And through this, I also realized that, uh, a parent gets empowered through these sessions. Sitting outside, not knowing what is happening inside,
Yeah.
the parent is not really aware. So, now this parent is so much aware and try to find different ways and means to make
Correct.
this happen also. So I
Yeah.
think this plays a very crucial role.
Yes. Thank you. Thank you so much for joining me, and being a part of the session, and also having me to do this.
Yeah, thank you, Dr. Sana. So, a lot of insight has come through this session. We have received, basically about many things about what is therapy, how the therapy room should be, or what are the different therapies that are recommended, and how long should it happen, and many a things that has come through, and it will certainly serve as a guidepost for lot of parents who have newly diagnosed kids. Yeah,
Thank you.
thank you so much.